You know that feeling when you just want to get something, understand it properly, but without wading through tons of complex terms?
Exactly.
That's what we're doing today. We're taking a deep dive into canine Legg-Calvé-Perthes disease. It affects our furry friends, specifically their hips.
We've looked at some really solid sources. They give a good medical overview, what it is, what we think causes it, diagnosis, treatment, the whole picture.
Right. And our mission really is to pull out the most important bits, the interesting stuff, and chat about it so you can understand it clearly without feeling overwhelmed.
Sounds good.
Okay, so Legg-Calvé-Perthes disease. It sounds quite serious. What's actually happening in the dog's body?
Well, basically, it's a spontaneous degeneration. It affects the top part of the thigh bone, the femoral head and neck.
The ball part of the ball and socket joint.
Precisely. That ball and the bit connecting it to the main bone start to break down. And the end result is the hip joint collapses and the dog develops osteoarthritis.
A structural breakdown, then. You said spontaneous, which always makes me curious. Do we know why this happens? What triggers it?
That's the million-dollar question, really.
Yeah.
The exact cause. Still unknown.
Ugh.
But what's really telling is when pathologists look at the tissue samples, the histology, they see evidence pointing strongly towards a vascular problem.
Like blood flow.
Exactly.
Yeah.
The current leading theory is that something interrupts the blood supply to that top part of the femur. This leads to what's called infarction, basically, tissue death, because it's starved of oxygen.
Okay.
And we see signs of this, necrosis of the bone right under the cartilage. This weakened bone then starts to deform just from normal activity, like walking or running.
So the lack of blood weakens the bone structure itself.
Yes, and it's not just the bone, the cartilage covering it, the articular cartilage that allows smooth movement, it starts to suffer too. It can thicken, get cracks, fray. It loses its smooth surface.
So the whole joint mechanism is affected.
Right. And interestingly, the body does try to fight back. You see signs of damage, but also attempts at repair, signs of ischemia, but also revascularization, where the body tries to grow new blood vessels in.
A battle zone in the joint?
Kind of. But it's worth noting, they've looked for issues like blood clotting disorders, and there's no evidence for that being the cause.
Okay, so not a clotting issue, but definitely something cutting off the blood supply. Now, does this happen in any dog, or are certain types more at risk?
Well, there's a very clear pattern here. It's much, much more common in miniature, toy, and small breed dogs.
Ah, the little guys.
Yep. Breeds like Manchester Terriers, miniature pinchers, toy poodles, Westies, Cairns, Lakeland Terriers, they have a higher incidence than you'd expect.
And is there a typical age this shows up?
Usually between 5 and 8 months old, though the range can be anywhere from 3 months up to about 13 months.
Still quite young then.
Very young.
Right.
And usually it's just one leg unilateral, both legs bilateral happens, but less often, maybe 12 to 16% of the time. And it affects males and females equally.
Okay, so if you've got, say, a young toy poodle starting to limp, this should be on the list of possibilities. What signs would an owner actually see at home?
The main thing is lameness, a limp. And it usually comes on gradually, gets worse over maybe 2 or 3 months.
Not usually a sudden thing then.
Now, more progressive. And when the vet examines them, pain when moving the hip joint is almost always there. That's a key finding.
Okay.
Sometimes you might feel a kind of grating in the joint crepitation, but not always. What you do almost always see is muscle atrophy. The thigh muscles on the affected leg start to waste away because the dog isn't using it properly.
That makes sense. But otherwise, the dog seems okay.
Yeah, generally. Apart from the leg issue, they're usually bright, alert, normal puppy energy.
Right. So back to the cause for a second. We know it's likely vascular, common in small breeds. Any more specific theories about what interrupts that blood flow?
Well, the most commonly suggested mechanism involves something called tamponade. Basically, compression.
Compression of what?
Of the small blood vessels that supply the femoral head, the ones that run within the joint capsule itself. The idea is that something squeezes these vessels, maybe increased pressure within the joint, cutting off or reducing blood flow.
Like kinking a hose?
That's a good analogy, yes. And again, being a small or toy breed is the biggest risk factor we know of. Some also suggest maybe trauma could play a role, perhaps initiating that process in susceptible dogs, but the link isn't definitively proven.
Okay, so breed is key, and maybe this vascular compression idea. When a vet suspects this, what else could be causing similar signs? What do they need to rule out?
Good question. Differential diagnoses are important. In these young toy breeds, you also have to think about a luxating patella, a kneecap slipping out of place. That's very common.
Right.
In older dogs, maybe a cruciate ligament tear. Hip dysplasia can sometimes look similar on x-rays too. And of course, you have to consider a simple fracture from an injury.
So how do they tell the difference? Imaging.
Exactly. X-rays or radiographs are crucial.
And what do the x-rays show? Does it look different depending on how advanced the disease is?
Yes, it progresses. Early on, you might just see the space in the hip joint looking a bit wider, maybe some decreased bone density in the femoral head, and the femoral neck might look a bit denser, sclerotic.
Subtle changes.
Can be. Later, you start seeing these darker patches loosen areas within the femoral head itself, showing where bone is being lost.
Okay.
And in the end stages, the femoral head is clearly flattened, deformed. You see obvious signs of arthritis, and sometimes the femoral neck can even fracture completely.
Wow, quite a progression of damage. And if you were to look even closer, say, at the tissue level during surgery, what's going on with the cells?
Pathologically, the femoral head looks deformed. The cartilage surface is rough, irregular. Under the microscope, early on, you see dead bone cells, necrotic marrow. The little beams of bone, the trabeculae, are surrounded by this sort of inflammatory repair tissue, granulation tissue.
The body trying to heal again.
Right. Later, you see a mix, some thickened bone, areas of dead bone, areas of new bone forming as the body tries, often unsuccessfully, to revascularize and remodel. Advanced cases show bone breakdown alongside new bone formation, but it's disorganized.
A real mess at the microscopic level. Okay, let's talk solutions. What can be done for these dogs? What are the treatment options?
There are really two main paths, conservative management and surgery.
Conservative meaning rest and meds.
Yes, strict rest, pain relief. Some sources say maybe a quarter of dogs get some relief this way, but it's often not enough for a good long-term outcome. It rarely resolves the underlying problem. There's also mention of an Immer sling to immobilize the hip, but that's generally not recommended because the joint can fuse up, get stiff.
Ankylosing, right.
Exactly. So for most dogs, surgery is the way to go.
And what kind of surgery?
The standard, usually very successful procedure is a femoral head and neck excision, or FHNE.
Sounds like what it is, removing the damaged parts.
Precisely. The surgeon removes the ball and neck of the femur. This gets rid of the painful bone-on-bone grinding in the damaged joint.
And the dog can still walk.
Yes, because the surrounding muscles strengthen and form a sort of false joint or pseudoarthrosis. It allows for pretty good pain-free function. There's also a newer option for these little dogs, a micro-total hip replacement, micro-THR.
Like a tiny artificial hip.
Essentially, yes. That also has excellent results, restoring very normal function.
Okay, let's focus on the FHNE, as it seems more common. What's recovery like after that surgery?
Post-op care is absolutely critical. Pain management is key, especially the first few days. Analgesics, anti-inflammatories, cold packing can help with swelling.
And activity. You mentioned rest for conservative treatment.
It's the opposite here. Early controlled activity is encouraged after FHNE. Gentle range of motion exercises like carefully flexing and extending the leg should start pretty much right away.
To keep things moving.
Yes, and to encourage use of the limb. Some vets even recommend using small ankle weights, just above the hock, to kind of prompt the dog to put weight on the leg and build muscle.
Interesting.
The goal is to build up that muscle support for the false joint. And keeping the dog lean, avoiding obesity, is really important too, to reduce stress on the joints.
Makes sense. What about specific medications? You mentioned pain relief.
Right. NSAIDs, non-steroidal anti-inflammatory drugs, are the mainstays. Things like carprofen, meloxicam, daracoxib, eferacoxib. The vet will choose the best one and dosage.
Standard anti-inflammatories.
Yes. But you need to be aware of potential side effects, like stomach upset. They can't be used in all dogs. And there are precautions, like some can affect clotting, so maybe stop aspirin a week before surgery. And you definitely don't want to combine NSAIDs with steroids like prednisone.
Right. That increases stomach risks.
Hugely. You need a washout period of switching between different NSAIDs too.
What about things like glucosamine or chondroitin supplements? Do they help here?
While they might have a role in other types of arthritis, the evidence for Legg-Calvé-Perthes suggests they don't really provide much benefit, especially once the disease is advanced, and there's certainly no proof they can prevent it or reverse the changes.
Okay, so NSAIDs are the main drug support. How important is follow-up after treatment starts?
Very important. After surgery, regular checks, maybe every couple of weeks initially, are needed. The vet needs to see how the limb function is progressing and make sure the owner is doing the exercises correctly.
And if they tried conservative first?
Then rechecks are vital to see if it's actually working. If the dog is still lame after a couple of months, that's usually a sign that surgery is needed.
Now, we talked about the breed predisposition. Is there a genetic link? Can this be prevented through breeding?
It certainly seems so. In Manchester Terriers, it looks like a complex inheritance, but highly heritable. In Min Poodles and Westies, evidence suggests a simpler recessive gene might be involved.
So genetics are definitely part of the puzzle.
Absolutely. Which means the key prevention strategy is responsible breeding. Dogs diagnosed with Legg-Calvé-Perthes should not be bred.
Makes sense.
And if a particular mating has produced affected puppies, that specific breeding shouldn't be repeated.
Okay. Are there any potential complications with the treatment, particularly the surgery? And what's the overall outlook?
With the surgery, the main potential issue is if exercise is too restricted afterwards. That can actually hinder getting full function back. But honestly, with FHNE, the prognosis is generally reported as good to excellent.
Really high success rates.
Yeah, often cited in the 84 to 100% range for significant improvement or return to good function. Micro-THR also has an excellent prognosis. Compare that to conservative management. Maybe only 25% see good lameness relief.
So surgery really offers the best chance.
Overwhelmingly, yes.
If you had to give owners of these predisposed breeds just a couple of key messages, what would they be?
I'd say, first, be aware this exists, especially in those small terriers, poodles, etc. Understand there's likely a genetic component, so talk to your breeder and don't breed affected animals.
Right.
Second, if your dog needs the FHNE surgery, be prepared for the recovery. It could take time, maybe 3 to 6 months, for maximal improvement. And consistent physical therapy and following the vet's instructions are absolutely crucial for getting that great outcome.
Good advice. So, wrapping this up then, Legg-Calvé-Perthes disease is basically a hip problem in young small dogs where the blood supply to the top of the femur gets disrupted.
That's the core of it.
The exact why is still a bit fuzzy, but genetics play a role, especially in certain breeds.
Correct.
But the good news is that surgery, usually the FHNE, works really well for most dogs, giving them a good quality of life back.
Absolutely. And what I find really fascinating is that interplay. We suspect genetics, we suspect a vascular event, but the precise trigger, that environmental factor or combination of things that sets it off in this susceptible dog that's still elusive, it's just a great reminder, isn't it? Even with conditions we see relatively often, there's still biological mysteries to unravel. It really underscores the complexity we're dealing with in medicine and biology.